Welcome back. Tonight, we're taking a look at how expensive prescription drugs are and how the soaring costs are pricing millions of Americans out of the market. They just can't afford the hefty price tag for life-saving prescription medications and treatments. 58 million Americans have experienced something called medication insecurity. A 2019 Gallup poll found where they can't afford at least one medication in a given year. Prices in the U.S. across all drugs are the highest in the world, nearly 3 times higher than in other developed countries. Americans paid $2.78 for every $1 paid in comparable nations. Brand drugs in the U.S. were 422% higher, but generic drugs are 67 cents in the U.S. compared to $1 in other countries. Scripps News Tonight medical contributor Dr. Omer Awan joins us now to break this all down. Thank you so much for being here, Dr. Awan. This is really scary to need medication, sometimes life-saving, and to have to figure out how you're going to pay for it, or it might be for your child or your parent. What can we do now to address those fears?
Well, we have to understand why this is taking place in the first place, Maritza, and I think a lot of it has to do with the fact that the federal government doesn't regulate these drug prices like they do in many other countries around the world. So that means that drug manufacturers and drug companies can literally set the prices at will and have a monopoly on this process. And they're able to set these prices astronomically high for a profit, whereas so many Americans can't afford this. And you just said that 58 million Americans can't afford this. And that's a huge number. And that's an unacceptable number. We're talking about millions of Americans that won't be able to take a drug that can prevent an illness or even, stop an illness, stopping or preventing hospitalization, even, God forbid, death. So this is a real problem. And, it's a very complicated process, but I think the crux of the matter is that the federal government really has to start more strict and more stringent regulation on medication and medication prices and the way we set prices.
So you list some specific examples in a recent article you wrote in Forbes. For instance, the cost of a vial of insulin costs about $99 in the United States. It costs 4.7 times more than the same vial of insulin in the second most expensive country, in Chile, which prices it at $21. And then if we go over to a pill that can cure hepatitis C, $13,000 for a monthly supply in America, less than $200 in Ethiopia. And it seems confusing. It seems intentionally confusing. Am I off base?
You're not off base, and it's a problem. And, it's a shock. And I would think that a lot of even healthcare professionals would be surprised when you present this data out to them, because it's alarming on a lot of levels. And, part of the process and part of the problem is also this issue with patents. A lot of these drug companies get patents that prevent other drug companies and manufacturers from coming into the market to sell the drug at a much cheaper price. And this is a problem. This comes also down to the greed of big pharma, because they're able to price these drugs. They're getting a ton of profit. And yes, of course, they have to use money to drive research and innovation, but they're using this money, and there's so much more profit that they're using for stocks and dividends versus actually creating the drug. So I think it's unacceptable on a lot of levels. And, the United States has to do better. We're the wealthiest country in the world. We have to provide and take care of our own citizens, especially when it comes to healthcare and health and well-being.
You also talk in your article about patents also providing more barriers to lower prices because a generic can't come on the market for a lower cost. So I guess the question is the primary goal of big pharma to help people or to make money?
That's for other individuals to decide. The bottom line is that if we look at the data, and I think Senator Bernie Sanders has also pointed this out, that the bottom line is that yes, they are driving innovation, they are doing good. If we take a look at HIV, this whole class of antiretroviral therapy has changed the course of HIV. Now people are not dying; they're living normal lifespans, provided that they take a daily drug. But at the same time, this big pharma are spending way more. They're getting billions of dollars from, stocks, dividends, much more than they are for research, or for putting for research. So, it's a very wide open question for everyone to decide, what is big pharma really doing? Are they really treating patients? Are they there for the well-being of patients? Or are they in it for themselves? And I think that's something that everyone should ask themselves.
Okay, so we talk about several avenues where there are some potential solutions. Why hasn't anything been done in Congress to tackle some of these things or gotten done?
I think a lot of it has to do, Maritza, with the lobbying and the lobbying power of big pharma. Big pharma has a huge lobbying base. It's very difficult to do anything and to get bipartisan support. But there is good news, Maritza. I mean, I think the Biden administration seems to be very keen to helping and to mitigating this situation. They've already announced a cap on insulin to $35 per product per month for senior citizens. That's a huge deal. I mean, it's still more than any other country, but it's less than $100. And they've now allowed, or will be going to allow, Medicare to negotiate the price of at least 10 prescription drugs with drug makers. And the 10 drugs are very common drugs that treat diabetes, heart failure, blood clots. So this is all good news. But again, this only applies to seniors. There are millions of Americans in their 40s and their 50s that have cancer, that can't afford drugs. I mean, I personally know individuals who are struggling. I mean, they have to offset their mortgage, or they have to not get groceries or limit their groceries just so they can buy drugs to treat a certain illness. And that's alarming, and that's should never happen, especially here in America.
Terrible choices to have to make. Dr. Omer Awan, as always, thank you so much for talking with us tonight. We appreciate you.
My pleasure, Maritza.